These are my reasons why Singapore should not have a vaccine mandate. Point number 1. The vaccine is not old enough for anyone to be certain of its safety. Even if the vaccine is as what the government says it is, to 100% accuracy, we don't know what is going to happen 10 to 20 years later. Every form of safety data and assurance we have is all in terms of probability. For the reason that it is a probability, mandating people to take the jab is essentially forcing people to take the jab with a probability, or chance, or possibility that it might end badly for them, no matter how slight the chance is. Even if the government wants to compensate in medical coverage, the damage is already done. No amount of medicine can reverse the damages done. People should have the right to reject something potentially harmful. Taking away these rights is a form of oppression. The vaccines may be mostly safe now, but we won't know for how long. If we look at the history of Singapore, we can see that all 3 vaccines mandated by law in Singapore existed long before the mandate was given. Therefore, enough time was given to prove the vaccine's full safety. The smallpox vaccine was introduced in 1796. It was only made compulsory by 1863. The diphtheria vaccine was introduced in 1926. It was only made compulsory by 1961. The measles vaccine was introduced in 1963. It was only made compulsory by 1985. To mandate the COVID vaccines now is to not give enough time for the vaccine safety to be proven for long-term use. Therefore, the COVID vaccine should not be mandated because they are not yet convincingly safe, and the only way that they can be proven to be convincingly safe is after a long enough period. Moving on to point 2. Real-world observation shows that the vaccines do little to contain the spread of the virus. The vaccines alone don't do magic in containing the virus's spread. A whopping 96% of the eligible population are already vaccinated, yet many of those under the 96% still got infected with COVID. If we judge the vaccine success rate based on this metric alone, it's sufficient to say that the vaccine failed to contain the spread of COVID. On top of that, the fact that 96% of the eligible population already have the vaccines, yet COVID can still spread rampantly, goes to show that vaccinating the remaining 4% does little to help stop the spread. Therefore, a mandate will not do anything much to help stop the spread. We cannot blame the younger teens and children who are unvaccinated. If it was them, the data and evidence would be clear. But there's no strong evidence suggesting that. The number of people getting COVID is generally consistent across all ages. If the unvaccinated people are contracting and spreading COVID rapidly, we would see most COVID cases occurring among young children and among those who are unvaccinated, but that's not the case. Therefore, the real-world observation shows that the vaccines do very little to contain the spread of the virus. Point number 3. Not everyone needs vaccines to reduce death rates significantly. According to the CDC, more than 81% of COVID-19 deaths occur in people over the age of 65. This suggests that COVID is almost explicitly an age-specific problem. And again, according to the CDC, the risk of severe COVID-19 cases increases with the number of underlying medical conditions in a person. Let's take a look at this graph here from this website. It's the graph of the proportion of COVID cases who died by age and vaccination status. Here you can see the trend that the risk of severe COVID and deaths increases exponentially with age. Keep in mind that these cases of severe disease and death include those who have underlying medical issues. This suggests other factors contribute to the increase of this number. Keep in mind also that one's chances of having underlying medical conditions generally increase with age. Upon further analysis of this credible government data, we can see that those aged 50 and below have more than 99.8% chance of survival. In other words, a fatality rate of less than 0.2%. The survivability rate is consistent among those below age 50. It starts to grow exponentially, with those aged between 50 to 59 still having a good chance of survival, at about 98%, so about 2% fatality rate. Where it gets concerning is for those above age 60. Those aged 60 to 69 have a fatality rate of about 7%. Those aged 70 to 79 have around 19% fatality rate. Those aged 80 and above have a fatality rate of around 40%. Therefore, to reduce death rate significantly, vaccinating those below the age of 50 does not make a significant reduction. And thus, not everyone needs vaccines to reduce death rates significantly. This therefore devalues a need for a vaccine mandate for those under the age of 50. Point number 4. Not everyone infected is a real burden to the healthcare system. How much of a burden you are to the hospitals if you get infected with COVID largely depends on your age group. I draw my data from the MOH website's chart titled Proportion Percentages of Cases Ever Critically Ill in ICU or Died by Age and Vaccination Status. For every age group under 50 years old, less than 1.5% of cases were ever critically ill in the ICU or die. Of course, again, if you see the graph for yourself, the percentages decreases sharply with age. It's less than 0.2% for those aged between 20 to 29 years old. Less than 5% of COVID cases for those aged 50 to 59 ended up critically ill in the ICU or die. Again, it seems like those aged 60 and above present a number that's concerning, with percentages upwards of 10% or much more. On the same website, another chart here shows just hospitalizations by age group. This follows the number of people hospitalized in the past few days, so it's subject to change. But the proportion is very consistent here. Those aged 59 and below are about a third of those hospitalized. Those aged 39 and below are only about 10%. Thus, the evidence is clear that most of the people who are hospitalized are the elderly, and most of those who fill up the ICU beds are again the elderly. You can check the website for yourself. Every chart they show there supports my claim. Not everyone is an equal burden to the healthcare system. Some age groups are an order of magnitude more than the rest. This therefore again devalues a need for a vaccine mandate for those under a certain age group. By the way, I really hate to use the term burden, but this is the message I'm getting from some of those who are vaccinated, that the unvaccinated are quote-unquote a burden to our society. Moving on. Point number 5. 100% vaccinated nation does not guarantee stress-free hospitals. Sure, our hospitals would not be filled as much if everyone was vaccinated, but here is something for you to consider. The hospitals wouldn't be filled up just as much if our cases didn't skyrocket so soon. If you look at the statistics more clearly, many of whom who entered the hospitals and eventually died were partially vaccinated. This means that they wanted to be fully vaccinated, yet died. This is a shortcoming of the existing public policies because many soon-to-be vaccinated people died. These deaths should have been avoided. Furthermore, vaccination alone doesn't guarantee no hospitalization and death. The data is clear that those who are vaccinated can still be critically ill and still die. Therefore, a 100% vaccinated nation does not guarantee stress-free hospitals. This again further devalues the need for a vaccine mandate. Alright, I'm done elaborating. Let's recap the 5 reasons. Number 1. The vaccine is not old enough for anyone to be certain of its safety. Number 2. Real-world observation shows that the vaccines do little to contain the spread of the virus. Number 3. Not everyone needs vaccines to reduce death rates significantly. Number 4. Not everyone infected is a real burden to the healthcare system. Number 5. A 100% vaccinated nation doesn't guarantee stress-free hospitals. Those were my reasons above as to why we shouldn't have a vaccine mandate. These are the policies I suggest to be implemented and their reasons why. Number 1. I request the removal of workplace VDS measures for those unvaccinated aged 50 and below. Young and healthy individuals should have the right to be able to enter the workplace without having to do pre-event testing. Number 2. I request the removal of other VDS measures for those unvaccinated aged 50 and below with regards to VTL. It is not difficult to administer and therefore I see no reason why it can't be done. Number 3. Introduce a policy to encourage companies to keep those vulnerable to be working at home, regardless of whether or not they are vaccinated. I am of course talking about those aged 60 and above, or those with significant underlying health conditions. Incentivize the elderly to get vaccinated. This means more vaccine injury coverage over a long period. There should be no monetary threshold for those who are injured as a side effect of the vaccines. To simply put it, if the government believes so much in the vaccines, they should put their money where their mouth is. Currently, there is a monetary threshold under the MOH website itself. Link is in the description. If all else fails, consider a partial vaccine mandate as the last resort. This partial vaccine mandate must only be applied to those aged above 60. The risk-reward considerations for those who are young and healthy mostly don't justify a need for the vaccines. For these reasons I've explained throughout this video. It may be more of a risk than a benefit for the young to be taking the vaccines, considering that we don't know what may happen 10 years later or longer. The risk-reward consideration for someone who is above the age of 60 justify getting the vaccine, since they are at much higher risk of dying from COVID as an immediate threat, and therefore they need an immediate solution. To conclude this video, I urge the government, and a lot of Singaporeans for that matter, to stop obsessing over the vaccines. What more do you want? 96% of the eligible population being vaccinated is a dream come true for some countries, and yet we are far from defeating COVID fully. Let's stop focusing on those unvaccinated, because not all unvaccinated people are vulnerable. Let's instead focus on those vulnerable, because not all vaccinated people are invulnerable. I believe that if we focus more on the vulnerable, we will enter an endemic state sooner. Thanks for listening.